I apologize about the technical issues, but we are now up on YouTube.
Great. All right. Well, welcome everyone. We have a briefing today from our public four-year institutions. The public should note that that will not obviously include our community colleges. Our private institutions have submitted written testimony, which the committee can avail itself of. The briefing will include two major issues, to include the financing difficulties presented to the institutions by the pandemic, as well as any safety precautions that they've put in place for the safety, health, and welfare of both their students and their staff. So with that, I'll turn it to Chair Zucker for any preliminary opening remarks.
Well, thank you very much, Mr. Chairman. I think you covered it. I would just remind delegates and senators that if you have any questions throughout the briefing, please utilize under the participants icon, the raise the hand feature, and Chairman Barnes and I will be looking out and calling on you if we see your hand raised. And with that, Mr. Chairman, back to you.
All right, well, let's turn it over to our first panel, which will include USM, including Dr. Perman, Ellen Herbst, and Dr. Pines. Please.
Chair Zucker, Chair Barnes, members of the subcommittees, thank you for the chance to discuss the university system's handling of the COVID-19 crisis. Before I get into the preparations we've undertaken for fall, I'd like to explain briefly why we've chosen the course we have. We have elected to resume some in-person instruction this fall. However, to a large degree, the university system is operating in a remote format. The cornerstone of our plan is de-densifying our campuses, telework for employees who can carry out their jobs remotely, reducing the number of students in our residence halls, reducing the number of courses offered in person. In the end, less than half of our total student population is on campus this semester. We've elected this course of action with the engagement and support of our student leadership, as well as our faculty and staff representatives. By allowing the majority of students to receive a high-quality education away from our campuses, this plan enables those students who really do need in-person instruction to get that instruction safely. And some of our teaching does require face-to-face interaction or demonstration, in-person performance, observation, such as clinical courses, lab courses, performing arts courses. To be a doctor or a nurse or a dancer, there simply must be some in-person work. In addition, some of our students need what our campuses offer. Students with nowhere else to go, students who are unsafe, students who are stressed financially, students rural or urban, without technology or connectivity or even a quiet place to study. Allowing no in-person instruction and no on-campus housing would delay or potentially derail the education of these students, with impacts not only on their careers and earning power, but on their mental and emotional health. So for now, yes, we're talking about only one semester, but it's becoming clear that how universities approach the fall semester is influencing their approach to the entire year. Few universities that are fully online this fall hold out much hope for transitioning back to campus this spring. And so those students who need on-campus support could be denied it for some time. We're keenly aware that this support is especially vital to the students most susceptible of dropping out: low-income students, first-generation students, underrepresented minorities. We need to try very hard not to lose them. I'm not saying that we can't accomplish our educational mission while we're apart, because we've spent months refining our online courses and training faculty in remote instruction. But we can more effectively serve our students when we can tailor our approach to their needs. That applies to our universities as well. The university system is incredibly diverse in institution size, type, location, in the students and the missions they serve. Their surrounding communities are radically different from one another, and conditions in those communities are fluid. And so our presidents, working hand in hand with their local health departments and with the system's own scientists and public health experts, need to be able to make decisions that make sense for their own campus and their own community. This heterogeneity and this need to be responsive to local conditions compel differences among the university's plans. So what the system has done is set baseline expectations that every university must meet. I quickly will go through them now. On every campus, all disease prevention practices must be followed. Physical distancing, mask wearing, etc. These policies are written into student codes of conduct and employee handbooks, and virtually all universities have issued penalties for non-compliance, including fines and suspensions. All universities must provide sufficient personal protective equipment for students and employees. We most recently surveyed our universities last month as to whether they had adequate equipment on hand for all appropriate personnel and whether they had distributed the equipment to employees. We have assurances that all universities have done so. All universities must have adequate isolation space on campus for residential students who test positive for COVID, and quarantine space for those who are symptomatic or who've had contact with a known case. All universities must work with their local health department on reporting positive cases and conducting contact tracing. On this front, I'm pleased to share that we're working with the State Department of Health to match our student records with the CRISP database, Maryland's Health Information Exchange. Matching these records means that no matter where a student gets tested for COVID, through his or her provider at a community testing center, if that student's test positive, we'll be notified of the result immediately. This is critical to transparent reporting and efficient contact tracing. Of course, we'll comply with all privacy regulations. If that works well, we'll see what's possible in terms of our employees. In terms of COVID monitoring, all system institutions were required to conduct baseline testing of anyone returning to campus this fall, or to have students and employees provide confirmation of a negative test result. Now that Labor Day has passed, every residential university is conducting another round of large-scale testing. In addition, universities are doing sample testing periodically throughout the semester. Of course, all symptomatic individuals, anyone exposed to a known case, must be tested. Additionally, all on-campus students and employees must conduct daily symptom self-monitoring and reporting. Taken together, this process for prevention and monitoring is exactly what Dr. Anthony Fauci has said universities should do. 1, test students before they return to campus. 2, conduct intermittent surveillance testing throughout the semester to watch for rising cases or clusters. And 3, have appropriate space to isolate students who do get infected. That's our playbook. In addition, given the system's deep expertise in biomedicine, our experts are monitoring advances in COVID testing so we can improve our process. The PCR or molecular tests we're using are effective, but they're also invasive and results are slow to return. So we're working on securing more convenient options like reliable point of service testing that can return results quickly and improve disease containment. What I've described is a thoughtful plan, a plan guided by the safety of our students, faculty, and staff. But that doesn't mean it'll work. And so each university has an escalation path for the steps officials will take should COVID cases grow on campus. These steps can be anything from more frequent communication about disease control compliance, all the way up to a pivot to remote-only instruction and mandatory telework. Towson University did make that pivot when confronted with a number of positive cases that contact tracing couldn't explain through a common gathering or source. Salisbury University has reported an escalation of cases, and officials there have been transparent in communicating with the campus community and with the public at large. The university is managing the escalation in coordination with the Wicomico County Health Department. And as you'll hear from President Pines, when considering his own challenges at College Park, different challenges than the two universities I mentioned, he responded by adapting. He kept classes online for the first 2 weeks of school. Faced with the long-term prospect of COVID, many experts are advising exactly this kind of flexibility, tightening and loosening restrictions in response to changing conditions. The most important point is that these decisions are made in partnership with each university's local health department and in consultation with system experts. There's no policy or protocol we've adopted that is as important as that simple fact, that we're managing this crisis together and that at the center of every decision, we've put the safety of our people. Before I give my last minute to Vice Chancellor Ellen Herbst, I do want to mention that I have some system colleagues joining me for questions, Vice Chancellor Joe Boffman and Patrick Kogan, Associate Vice Chancellor Carolyn Skolnick. Additionally, from our universities, College Park President Pines, UMES President Anderson, Frostburg President Nowacek. And now,
welcome to all.
Thank you. Thank you, Chancellor. If we could put the slides up. And thank you to the chairs and subcommittee members for all of your support. As the Chancellor has already said, all of our decision-making starts with what's the right thing to do. And the right thing to do for us is put the health and safety of our students, staff, and faculty first. The right thing to do is to continue to provide a quality education to our students. The right thing to do is protecting our employees financially to the extent possible. So our financial outcomes are the result of doing the right things in all these areas. The financials don't drive decision-making, it's the other way around. And with that said, I want to share with you what doing the right thing has meant financially. Next slide, please. The top line is we've taken reduction in all areas of funding and sustained increased costs. Tuition, fees, housing, and dining, we froze rates at FY20 levels rather than implement the increases that had been approved. We've seen reductions in on-campus students for the safety reasons the Chancellor mentioned, which leads to a reduction in housing, dining, and other auxiliary funding, as well as we've seen some reduced enrollment on campuses. We have taken reductions in events and conferences, and at the same time, we've incurred cost increases. We've increased the costs so that we could address testing, symptom monitoring, safety and health training, dedication of those quarantine and isolation facilities, and distribution of PPE. We've also made increased investments in our facilities for wayfinding, enhanced, more frequent cleaning, HVAC upgrades, hands-free entrances and exits, and we've increased our already considerable investment in technology for students and faculty so that we could continue to provide education online. Next slide, please. We created a mitigation process to identify a variety of financial tools to address the gap. And our mantra has been that we will do everything we can to reduce costs in other areas before impacting current employees. We've taken across-the-board cuts to non-personnel costs, including our daily operating costs, as well as reducing funding on facilities projects except for health and safety projects. We have also deployed our fund balance reserves. In other words, we're using funds from our savings account as a one-time solution to our current issues. We've frozen hiring and we've eliminated vacant positions. And finally, yes, we have announced temporary salary reductions. Those temporary salary reductions are being applied in a tiered way. That is, Those who make the most money are taking the largest percentage reductions, and we are sparing employees at the lowest pay rates from any action. Next slide, please. To put that last action in perspective, the total impact of lost funding and increased costs thus far at the system level is now estimated as of our July 31st estimate to be $500 million. And I can tell you that we think that number is going to go higher. The total amount of savings from temporary salary reductions we've announced is $20 million. That's 4% of the overall gap. So we believe we have met our goal of minimizing the financial impact on employees. Finally, I want to thank you for your support. Without the strong support of the state, all public higher education in Maryland would not be able to weather the storm we are currently experiencing. So we thank you and are grateful for your support. Thank you.
Thank you, Vice Chancellor. Let's turn to President Pines, and if it's okay, Mr. Chairman, we can take questions for these three panelists after that, after Dr. Pines. Dr. Pines?
Good afternoon, everyone. Good afternoon, Chair Zucker and Barnes, and members of the Senate Budget and Taxation Committee, and members of the House Appropriations Committee. Thank you for the opportunity to speak to you all this afternoon. My name is Darrell Pines, and I started Wednesday, July 1st, 2020, as the 34th president of the University of Maryland College Park. Hence, I've been on the job a grand total of 10 weeks, exactly to the day of Wednesday. As a short introduction of my personal background, I'm the product of two blue-collar parents who raised three children in a small two-bedroom residence in a low-income neighborhood in Oakland, California. Both of my parents were members of their respective unions. My father worked at the Oakland Naval Supply Center in shipping and receiving. And my mother worked two jobs, one as a bookbinder at UC Berkeley and the other as a factory worker in San Francisco. Because of my parents' experiences, my siblings and I were fortunate that their values of hard work, perseverance, and a core desire to give back to others became a part of our own core values. My parents emphasized the importance of getting an education, and my siblings and I were fortunate to earn higher education degrees to put us all on trajectories for successful careers. As a result of our own personal success and our parents' support, my siblings and I have created two named scholarships for children of union employees where our parents were union members.
Dr. Pines, we're on a pretty tight leash here. So if you can get into it, we're actually at the 15 minutes for the USM panel. We're going to extend that a little bit, but you can go ahead and just give us a briefing on the finances at the university and the health and safety.
Will do.
We would like to congratulate you and thank you and welcome you to these committees, though. We're certainly proud of you and looking forward to working with you.
Now I'd like to share with you the University of Maryland, how it worked towards phased fall 2020 reopening plan. For the past several months, we have worked, as the Chancellor mentioned, to develop and enhance plans for gradually reopening our physical campus this fall. Hundreds of faculty, staff, and students are collaborating in work groups and in teams to create an academically rich environment for the fall semester. Over 600 grants of over more than $3 million have been awarded to innovative approaches to online and blended education. We've also worked to create a physically distant, socially rich environment, including the resumption of activities in STAMP Student Union, recreation and wellness programming, and a very de-densified on-campus residential experience. We have developed extensive health and safety measures, enhanced cleaning and disinfecting of our campus facilities, conducted campus-wide testing to measure baseline COVID-19 infection rates, and launched efforts to monitor wastewater and air quality for the virus. In addition to collaborating with faculty and staff and students, planning has been coordinated with state and county officials and guided by recommendations of the University System of Maryland. The university leadership is also consulting with University Senate leadership in this planning process. We had four core principles: prioritize the health and safety of every member of the university community, protect and support the educational and research missions to maintain academic excellence, make decisions grounded in our values of equity and inclusion, provide a timely and transparent communication to and obtain feedback from internal and external stakeholders about the proposed plans. As the Chancellor mentioned, one of our strategies was a 2-week delay in extensive testing. On August 10th, I announced that the university would delay the resumption of limited number of undergraduate in-person classes until Monday of this week. This 2-week delay allowed us to consider a wide variety of factors before commencing in-person instruction, including quarantine and isolation space, the number of unconfirmed self-reported positive cases, and county compliance and positivity rates. Critically, it has also allowed us to conduct campus-wide COVID-19 testing for faculty, staff, and students. We have now conducted over 20,000 tests over a 15 to 21 day period, and our positivity rate is 1.1%. And we have administered tests such that we have 212 positive cases. Starting this week, we're offering even more opportunities for free COVID-19 testing to our entire community. Based on careful evaluation of our comprehensive list of factors, I announced that we would proceed with our cautious, phased approach to the resumption of limited in-person instruction for undergraduate students on Monday of this week. This represents approximately 15% of our undergraduate classes offered here at the University of Maryland. Now to the budget. The effects of COVID-19 on our fiscal 2021 budget has been significant, profound, and the largest in the history of the University of Maryland College Park by an order of magnitude. Fiscal 21 deficit is $292 million. We implemented a number of cost-saving measures, including a hiring freeze and travel freeze and temporary salary reductions for all employees with annual salaries greater than $150,000. While we realize that any temporary salary reduction is regrettable, 90% of the university's employee workforce and over 99.8% of employees represented by AFSCME will see no reduction in their salary at all. I thank you for the opportunity to give me this chance to present. I'm happy to take any questions on our gradual phase-in approach of reopening the University of Maryland's physical campus.
All right, thank you very much, Dr. Pines. We appreciate you being with us. Chancellor Perman, Vice Chancellor Herbst, are there questions for this panel? Delegate Solomon, I think, has a question.
Thank you very much, Mr. Chair. Thank you, Chair Zucker, as well. Chancellor Perman, it's great to see you, even remotely. I wish we were in person. And Dr. Pines, congratulations and welcome. I just had a question, and maybe this will be better addressed after the AFSCME panel as well. But Dr. Perman, I know you and I have had that conversation about sort of the system versus the individual campuses. And one of the questions that I had is, and I really appreciate what Dr. Pines has said about, really restricting the number of layoffs and really working collaboratively with the union. And I guess, we've heard stories, and I've heard from some of my other colleagues that some of the campuses are not doing nearly as much collaboration with their unions and their workforce as I think we're seeing with College Park. And so I guess my question is, what kind of directives have come down from the USM to the individual campuses to say, if any, you should be working collaboratively, you should be having this, you all should be getting to the table. We know we're in a budget crisis here. How do we work collectively to, minimize the impact versus just saying, you kind of do what you feel is necessary?
Thank you, Delegate Solomon, and I too wish we were together. The time will come. We've made it very clear, and by the way, I meet with the presidents, with leadership from student affairs to finances 3 times a week. And we've been doing that since April. So this is not a matter of sending memos, checking in every once in a while. We're intensely engaged with each other. And we established the principle very early on, one that Dr. Pines indicated, that we were going to try to protect our employees, all of our employees, as much as possible, especially our staff, especially our lower paid staff. That was established as a principle. And that's the way everyone has behaved. I think it's very clear to the presidents and to their cabinets that I expect the greatest amount of regard for all the constituents. We talk a lot about students, but we have to take care of our staff. We have to take care of our faculty. And I think that's been well established. Discussions, we're happy and eager to have discussions. I think, and I know this perhaps will be raised later, as you pointed out, I think that's different from negotiation, collective bargaining absolutely we ought to be talking with each other because we do care about the welfare of our staff. Thank you for asking me.
Thank you, Mr. Chancellor. And I would love to also have a conversation with you around the Leave Reserve Fund. I know I was hoping to get some information back from DLS as well, so I can talk to you offline on that one. But thank you for answering.
Happy to do that.
Thank you very much. Senator Sarah Elfreth has a question. Senator Elfreth.
Thank you, Mr. Chair, and good to see everybody, albeit virtually. I reiterate Delegate Solomon's gratitude for you working so diligently and conservatively over time and making sure campuses are returning in a safe manner. My question revolves around hazard pay, particularly for USM employees who are working in quarantine or isolation spaces. Can you speak a little bit about how we are compensating those folks to ensure that they're getting a little extra for taking on some of the more dangerous jobs in the state?
I'm going to ask Vice Chancellor Herbst to comment on our thinking there.
And in turn, I think Carolyn Skolnick has been involved in this most deeply. So if I could ask Carolyn, who's on the line here, to weigh in.
Ms. Skolnick is Director of our HR.
Sure. Thank you, Chancellor Perman. The institutions have been having discussions. Each of the institutions have been having discussions and are open to having discussions on issues of pay related to the current situation. When the institutions all in March determined it was necessary to move to remote instruction, for the period of the spring semester, certain employees who were required to come onto campus were offered either a cash equivalent payment or administrative leave equal to the administrative leave that was granted to any other employees in their unit. So that was done for a period that was longer, much longer than the state of Maryland provided a similar level of pay to its employees. Once that semester ended, the number of people on campus was reduced dramatically. And as we've moved into the fall semester, we're all in a better position to provide a very safe working environment with appropriate PPE. So to my knowledge, there has not been a specific offer of payment of hazard pay to employees. It is something that could be brought up for negotiation, but I don't believe that any institutions are currently offering specific hazard pay.
Mr. Chair, if I could follow up, just so I understand, we do have students who've returned to dormitories, and we do have dorms in certain institutions. I understand it varies institution to institution, but that are designated for quarantine or isolated spaces in case students have tested positive, and that must require staff to staff those. So I'm hearing that there is no current hazard pay directly for the staff that is staffing what I think we would all consider some of the higher risk jobs right now.
If I could respond briefly to that, and also College Park might want to weigh in with regard to their dormitories. But my understanding is that employees who, specifically at College Park, who might be asked to do housekeeping duties, for example, in dormitories where there are quarantined individuals, are being given the option to have another assignment and are not being forced to take on that assignment. So that's something that would provide an avenue for them to not have to deal with that particular situation.
If I could jump in at UMES, we have negotiated with our union team to do hazard pay for those individuals who are taking care of the students who are in isolation and or in quarantine. So we have recently had those conversations, and we have followed through with that negotiation with them.
And Senator, I'll respond from Frostburg State. We've actually contracted with an outside hotel, so our employees are not at all coming in contact with anybody who's been isolated or quarantined.
And Senator Elfreth, I also will respond for College Park specifically. And we have had the same policy, which is essentially It's a volunteer commitment by our employees and if they don't want to do it, they can be reassigned. And we've been also prepared to hire, as Ron just mentioned, for Frostburg, outside contractors to clean our spaces that are both in isolation and in quarantine.
Thank you all very much. Thank you, Mr. Chair.
I think Delegate Forbes has a question.
Thank you, Chancellor Perman and Vice Chancellor Herbst and President Pines. I appreciate your intense engagement on this subject matter and the charge to take care of all members of your community. My question's about testing. How often are you testing everyone now? Is it mandatory for everyone on campus? What's the schedule of the testing? Do all campuses screen and test the same? And is there an ongoing testing mandate for commuter students? Thank you.
Thank you, Delegate Forbes. First of all, anyone with symptoms, anyone thinking they've been exposed, they get access to testing. Plus, we did take a uniform approach to mandatory baseline testing. Now, with regard to surveillance testing, which is the crux of your question, we've instructed our institutions that they must do surveillance testing going forward. That's in fact a uniform requirement. Now, having said that, the heterogeneity, and there is heterogeneity in our surveillance testing protocols, which reflects the national scene on this matter. If there were one gold standard, one single validated approach, we would all use it, but there is not. So our institutional approaches reflect what I alluded to in my testimony. It's in consultation by each campus with their local health authorities in their community and county, and with our public health experts in institutions around the system. And we're constantly evolving in that. As a result of the broad testing that we're doing right now, we react to the incoming data, and that's going to influence the protocols for testing, the frequency of testing, the cohorts of testing as we get deeper into the semester. I think what I can say with some assurance is that we're being thoughtful, we're reacting to the data, we're reacting to the local conditions, the positivity rates, and that fashions the testing that we're doing.
Thank you so much. I appreciate the answer.
Thank you.
Thank you very much. Next, we're actually been joined as well by the Vice Chair of the Senate Budget and Taxation Committee, Senator Rosepep, and the Vice Chair has a question. Vice Chairman Rosepep, go ahead.
Thank you very, very much. I apologize. It took me a little while to get into this, so I actually missed Chancellor Perman's testimony and the first half of President Pine's testimony. So if this was covered, I apologize. I just want to start by saying I really appreciate the system, and particularly the College Park campus that Delegate Barnes and I represent, commitment to testing. We know that was a big lift, a big decision to be made, but I really appreciate the fact that President Pines took so much leadership on that, and the system has gone in that direction. My question relates to that. And again, everybody's busy. And so I talked with Chancellor Perman about this last week. President Pines and I have not had a chance to catch up, although he's on my trail, but I think it's worth discussing more broadly. Is earlier this year, the University of Maryland, Baltimore took the initiative to set up its own testing operation, which is terrific, which created capacity in the state that we desperately needed at that time, we need now. My understanding and impression is, and I want to get the facts out here so we're all on the same page, that is either the exclusive or the primary source of testing for our campuses in the system. And the reason I raised the question is my concern is that because the landscape has changed in terms of testing, in terms of availabilities, in terms of technologies, and the demand is so high appropriately, what is the status of availability and policy in the system and with the campuses on using tests in addition to those provided by the University of Maryland, Baltimore.
Let me take that, and good to hear you, Senator Rosa Pepp, and I do appreciate the conversations that you and I have had. We are very keen on the development of point of service testing. We're not sure at this point how the accuracy is going to play out, particularly in terms of asymptomatic patients. A lot of experts have raised that, but we realize that the ability to do point of service testing, which is a different test from what is being done at UMB, the PCR test, the molecular test, we know that that would be an advance. So this is a matter of time. We are keen. I guess what I would say to you is that there's no slavishness to using the UMB lab. Ideally, we would localize testing to the campuses. So we are watching the evolution, participating in the evolution. We've had conversations with the Department of Health about recent involvement and contracting related to point of service testing. We look forward to the advent of it.
Mr. Chancellor, I mean, I appreciate that a great deal. I agree with that 100%, but I was asking a little more broadly beyond point of site-based testing, which I think is terrific. And we had a briefing on that this morning in our COVID oversight group, but I meant alternative suppliers, because my concern is that we have a lot of kids going off campus to get tests because they can't get scheduled. And so my concern is whether the campuses have the flexibility to use other suppliers to provide the quantity and speed of testing that's needed.
Absolutely, yes.
Thank you.
Senator, this is Ron Nowacek from Frostburg. UMB is one of 4 providers for us, 4 vendors we're using on our campus.
Thank you.
Thank you.
Senator Rosa Pepp, I also want to speak, and I want to say thank you on your help as well, because we wouldn't be doing mandatory testing if it wasn't for your collaboration with the state's Attorney General. We appreciate that through the system and of course at the campuses.
Thank you.
I want to give everyone an update on how we're going, because you might want to ask this question about, you probably heard about the Big Ten decision to continue fall sports, and I want to explain it's really in the answer, it's in response and collaboration with what Chancellor Perman stated. We are moving to, the Big Ten is going to provide a firm for every university for all fall sports, for all student athletes, for all fall sports to be tested on a daily basis because of the nature of the contact that they may engage in, and high contact because of the sport that they play. Contact tracing is complicated by that. So the only way to resolve it medically and through a medical protocol is to have point of service testing on a daily basis that allows every student athlete to be tested, including trainers and coaches, by an antigen test, as Chancellor Perman was alluding to. It's going to be done by a private provider, free to the universities that are in the Big Ten, to provide the ability for our public health officials to okay that process throughout the Big Ten schools, and to allow for our student athletes to essentially play their sport and to have a clean practice field and a clean game day field. So I just wanted to provide some background on that.
Thank you.
Okay, I think we have our Vice Chair of the Appropriations Committee, Delegate Jackson.
Thank you very much. Chancellor Perman and the presidents that have joined us today, thank you very much for your briefing. I have a question for you all, and this concerns the budget process, obviously. Can the system provide, Mr. Chancellor, both committees, by institution, the amount of budget shortfall and the revenue sources, and how the institution plans to cover those shortfalls? We greatly appreciate that. That would certainly help us as we move forward. So for both committees, if we could get that, that would be good for us moving forward collaboratively. So
Thank you. Thank you, sir. And again, the answer is absolutely yes. We'd be happy to provide that information.
We look forward to it. Thank you.
Thank you.
And Dr. Perman, Dr. Pines, I have a quick question. I've dealt with both of you and your staffs on a personal level regarding the Medco issue and student housing. So I am a little up to date on it, but for the edification of the committee, I think it would be helpful to just give an update on where we are with Medco, the student housing issue, an issue that really delegates and senators all over the state have been reaching out to you and to us to try to solve.
We care very much, sir, about the financial implications of our reopening plan and how it affects students and their families. I think President Pines has been most central to these discussions and thinking, and I'm going to ask him to comment.
Fair enough.
Thank you, Delegate Barnes. I understand that this has been frustrating experience for our students and your constituents, and I acknowledge that the confusion with P3s, and many believe they are signing, a contract with the university, rather they're signing with obviously a management company, which is stated on the lease agreement. Unfortunately, these lease agreements are not made with the university, so that we were not able to provide the maximum flexibility that we did in our residence halls for our students and allowing them to be released from their leases. And providing multiple opportunities for canceling the housing agreements at no penalty, just because we don't control it. We've tried to work obviously with Medco and the management firm to have them have an opportunity to potentially release folks from leases. We've worked with our students to try to get them to find subleasers so they can get out of their leases. And we've done that for many of our students, but unfortunately we're not able to do it for all of our students. So we have made every effort, I think, to be in touch with students who wanted to be released from P3 housing and connect them, but we're not able to just do everyone. So that's unfortunate.
Well, we're going to ask you to keep working on it. Look, I know I speak for, because I've talked to all of them personally, Chair Gazone, Chair McIntosh, really all the members of the General Assembly. We've all reached out to Mr. Brinkley on this issue, and we really need a resolution to this issue. The semester's up and rolling, so we'd hope to hear something very soon. So thank you.
Thank you, Delegate Barnes.
Well, thank you very much, Mr. Chairman. Let me just reemphasize the points that I was going to bring up, as well as, we can get by institution the budget shortfalls, because in order to work as a partner with you, we need to know where the holes are and how you all plan to fill the gap. So thank you, Vice Chair Jackson, for asking that. And again, every day I'm hearing from delegates and senators about the Medco issue and our constituents. So we continue to look forward to working with you on that as well. And with that, we will turn to the next panel. We appreciate your all time, and those that can stick with us, please do. But at this point, we'll turn to the president of Morgan State University, President David Wilson. President Wilson, are you there?
Yes, I am, Mr. Chair.
Great. So I know that we're running a little bit behind, and we do have your slide presentation, but if you can go ahead and give us the highlights, it'd be appreciated.
Okay, I certainly will, and I will be cognizant of the time as well. So in the very comprehensive presentation that we've given to you, hopefully we have addressed the questions that you ask of us here at Morgan. And so whomever is advancing the slides, I'm just going to ask you to advance them every 5 to 6 seconds. We actually had put in place here at Morgan a very comprehensive reopening plan. That plan, of course, took into consideration hybrid instruction, reduced staffing on the campus, reduced all the things that you have heard just before this presentation, as well as across the genre of higher education in the United States. We had looked at a faculty option, student choice piece. We had taken dollars that we received from the CARES Act, and we had really gone about this campus every inch, cleaning, installing signage, doing everything that the CDC, Dr. Fauci, and our own School of Public Health here at Morgan, and then we brought in a national expert in this area, advised us to do. Going on to the next slide, we basically had looked at testing. I had been on, 8 to 10 national panels on testing. We looked at every single model we could possibly look at in the United States. Antigen tests were not even remotely available at the time, but even so, early on, I reached out to Chancellor Perman, the University of Maryland Pathology Associates, the first university in the state actually to do that, and inked an agreement with them to test the workers on the campus who were our frontline employees. These were our physical plant staff, our housing staff, et cetera, about 300 to 400 of them. And we reached that agreement and we started testing them as they were coming back to the campus. And they were very good about getting those results to us within 24 hours. And then we decided to expand that in our original plan. We, once again, were the first university to completely enter into an exhaustive agreement with them when we were in our original plan to test, if you will, all 3,000 students that we were planning to bring back to Morgan in congregate living arrangements. And we wanted to test them every 7 days. And once again, I had set aside in my budget dollars from the CARES Act to enable us to underwrite the testing every 7 days for all 3,000 of those students, moving right along as fast as we can, because I do want to get through this real quickly. So I indicated that we had done everything, classrooms, we had reconfigured the classrooms, we basically took about $3.5–4 million of the CARES Act dollars, and we have installed up-to-date technologies in classrooms. We are now about 85 of those classrooms with a goal of about 230 to do live stream to remote instruction. In essence, we were ready. We were ready. But we really like to listen here at Morgan to our faculty. We listen to our students. We listen to our staff. I had about 15 virtual town hall meetings that encompassed over 1,500 student voices, over 700 faculty voices, over 1,000 staff voices. And we collected all of that and we discovered that there was just really a lot of angst across all of those bodies about returning to the campus, period. If, for example, we could not assure them that they would not be infected, and we could not assure them. And so if you were to just move into what changed, because we are now 99.9% remote. And as I say to the university community here, we made the right decision. So we were going down this path, 65 miles per hour toward a hybrid reopening. I know that many institutions across the country had looked in at our plan. They had given us high marks for having this incredible, comprehensive, well thought out plan, testing strategy, but things changed. And so if you were to get to what changed. So there were 2 or 3 things that changed. Number one was that I brought on a national expert in public health. It was really an eye-opening experience where she informed us that we had one of the best plans in higher education in the country for a hybrid reopening. And then she went on to say, if you were in Germany. But unfortunately, we were not. And given the uptick in the cases here, that would have been a very, very difficult plan to execute. At the same time, the study came out from Harvard and Yale, which actually began to kind of change the dialogue on this topic. And it said that there is a way for campuses to reopen safely. And it is if they could test students 2 to 3 times per week. Well, we had this arrangement with the University of Maryland Pathology Associates to test our students once every 7 days. But we could not absorb the cost, nor would they be able to provide us with the supplies to test 3,000 students in congregate living every 2 to 3 days. Financially, that was not feasible. And then there was no availability, as you've heard from Chancellor Pearman, to a point of service test. And at the same time, in conversation with Johns Hopkins and President Daniels there, we have ongoing conversations, as I'm sure he has with Chancellor Pearman and other presidents as well, because we share data. And so if you go to that next slide, what we saw in Baltimore was scary because then the national conversation was around Baltimore becoming the next hotspot. And when we looked at this data at this time, what we saw was that if you basically look at 1 month previous to where we were when we put the plan together, in Baltimore, there was an average of about 11 new cases per 100,000. And then it jumped almost 100%. And so Baltimore was being talked about nationally as a hotspot. We then looked at the cities that are surrounding Baltimore, just run through those real quickly. We looked at Philadelphia, we looked at New York City, we looked at Washington, D.C., and we did not see the same thing. And so we have about 25% or so of our students from Baltimore City, and Morgan was determined not to be a super spreader because we would be bringing those students here, they'd be going back into the communities, and based on all of the science that we had followed, that was an untenable situation. We have the largest number of Black students in congregate living on any college campus in the state of Maryland. And therefore, we just looking at these data could not make an intelligent decision to do that. So that changed. So moving rapidly through, and I apologize for talking so rapidly. And so we then went to a completely online remote model for fall 2020, except for a few courses in nursing. Moving to the next one, all of our professors were asked to voluntarily teach remote and online, so 99% of them are. Then we reduced that number drastically from 3,000 students that would be living on campus. We normally have about 8,000 students here at Morgan, and over half of them are living on campus. And so we brought our plan to the board, took 3 board meetings, because at first we were somewhere between looking at 1,000 students, and then we couldn't manage 1,000 with this kind of regularity of testing. And then we settled on 300 to 400 students that are on the campus now. We have about 305 students that are on the campus now, but those students are being tested 2 times per week. There are no visitors allowed. They signed this student community responsibility acknowledgement that we are very serious about, that if you're going to stay on the campus, we expect you to adopt to what the university has said you must do in order to remain in this space. I'm not going to go through all of those, but these students are the ones that have these extenuating circumstances. Yes, extenuating circumstances, or those nursing lab courses on the one hand, but then we have international students here who have no place to go. We have students here who are food security, who are housing security. We have students who are technology security. And I know this because some of you may know, I actually took 2 online courses last spring when we decided to go online, because I wanted to get a first-hand experience about what our students were experiencing. And I learned a lot. And it was because of that that I was pushing that we would not close the campus completely, because I knew that we would have so many students who would almost be homeless. Moving on to the next slide, and then the next slide. And so, that was sort of the priority groups that we would have on campus. And I've talked about the insecurities that drove those extenuating circumstances. Onto the next slide, please. And so, these students that are living on the campus, they, of course, have a limited service, but we do have grab and go meals. Our entire dining room is set up where they can order meals online and then pick them up. And for the students who had paid meal plans, they, of course, got a refund. And for those students to come back on campus, they had to show a negative test within 10 days of moving back. And then the next day that they arrived on campus, we started the testing protocol. And so we have gotten through now 4 iterations of the testing, and we have had 1 positive case amongst the students. I don't want to repeat this. I've gone over most of that with you already. If you go on to the next slide, we do have our ROTC students here, because some of you may know that Morgan is number 2 in the nation in producing Black officers for the military. And we have several students who are in line to be commissioned, and we did not want to interrupt that. And so they are part of the 300. Student athletes are part of the 300. On to the next slide, if you will.
Mr. President, I'll give you another minute or so, but let's try to hit the highlights, and then I want to leave time for questions for you, because I know that your input's important, and I want to leave time for questions. So if you can sort of wrap things up, it would be appreciated.
Okay, so let's go to the financial piece here, Mr. Chair. Thank you very much. And so with regard to all the decisions that we have made, if we go to the financial piece, it is really resulted in a $28.8 million budget gap for the university. And as such, we are now about to roll out a strategy to try and close this $28.8 million. And it is hurting. It is hurting big time, if you will, because it certainly will involve salary reductions. It will involve furloughs. We are freezing all positions. We are continuing with a cost reduction plan. And what is really saving us from, I think, just a massive layoff here at Morgan is the fact that we were able to carry forward $15 million of the CARES Act money that will draw that deficit down to 13.8 million, and then we're trying to get the 13.8 million from all of the other strategies. And so, Mr. Chair, what we are hoping for in this process is at some point, perhaps we can get some state relief, and also we are hoping for another federal stimulus bill. And certainly we here at Morgan stand ready to work with you in any way in order to advance one or both of those. So being cognizant of the time, let me stop there, and I'll be more than happy to entertain any questions you may have. And that is my presentation.
Thank you very much, President Wilson. And I think to the committee's point earlier, that's why it's really important to know where the shortfalls are, what revenue is impacted, and what you're doing to help resolve it. But if any members have any questions, please go ahead and utilize the raise hand function, and we'll call on you. And Chairman Barnes, I'm not seeing any questions right now. Vice Chair Rosa Pep has a question, and then I'll turn it over to you, Chairman Barnes, to recognize the next panel. Vice Chairman Rosa Pep.
Yeah, thank you very, very much. And Dr. Wilson, I really appreciate hearing you, because I pay a lot of attention to the University of Maryland College Park and a lot less attention to Morgan. So I'm always pleased to catch up on what you all are doing. It sounds like you're really doing a good job. But I want to ask you a kind of big picture question that's relevant for all of us. What have you learned over this process that you think should and will inform how you operate, how you deliver instruction in the post-COVID environment?
Mm-hmm. I'm actually working on an editorial
on what you all are doing in
Post, hopefully for Washington Post. But the first piece, and I was going to actually have this discussion with the legislature, I'm learning that the state of Maryland desperately needs in Morgan a Research One urban university. That's where we need to go here at Morgan, to be a flagship urban research university, raising our hands to respond to all of the disparities that COVID-19 has revealed, and Baltimore City is the laboratory. And we're not going anywhere. And this institution is so incredibly poised to be that research institution. And in doing so, and I've looked at this, it will not duplicate, with all due respect to President Pines, what College Park is doing. It will not duplicate, with all due respect to President Roboski, what UMBC is doing. That is an unbelievable opportunity. And then the next one is simply, I was a huge proponent of online and distance education. I actually grew this function when I was the vice president at Auburn. I grew this function unbelievably when I was a chancellor within the University of Wisconsin system, overseeing half of that system. But what COVID-19 has revealed for Morgan is that that's not exclusively our future. That the students that we serve here, they really do need to have the majority of their college experience in a face-to-face, nurturing, supportive environment and climate. So Senator Rosa Pep, those are two things amongst about two or three more, but I want to be respectful of time.
Thank you very, very much. Very helpful. I appreciate it. Thank you, Mr. Chair.
Thank you very much, Mr. Vice Chair, and President Wilson. Thank you for your presentation. It was very thoughtful and thorough. And with that, I'll turn it over to Chairman Barnes.
Okay, thank you. And thanks again, President Wilson. It's great to see you. Next, we have St. Mary's College President Jordan. Welcome. It's great to see you, and you have 10 minutes as the rest. Thank you.
Oh, wow. Well, thank you so much, Chair Barnes and Chair Zucker and members of the committee. Good afternoon. It actually only planned on 5 minutes, so you might get some time back.
5, done.
I'm happy to be here today to discuss St. Mary's College and our response to COVID-19. With me today are Dr. Larry Leak, our trustee, and Chip Jackson, our government relations liaison. These are extraordinary times, as you've heard, and at St. Mary's College, we're facing these challenges always with our students foremost in our minds. Before I begin, let me express my appreciation and thanks for your support of the college, which is vital for us to meet our mission and to address the current challenges we now face. Next slide, please. We started classes 2 weeks earlier than originally planned to try to complete the semester before the anticipated second wave of COVID-19 coinciding with the flu season. The extensive COVID-19 precautions taken were developed in consultation and collaboration with local and statewide public health officials, higher ed leadership across the state, and St. Mary's College faculty, staff, and students, and in accordance with federal and state guidelines. A hybrid synchronous mode of teaching and learning was implemented to allow students and faculty to be simultaneously engaged either face-to-face or remotely, on or off campus, and affords an instantaneous transition to fully remote instruction should health conditions dictate it. Before I describe our efforts in more detail, I would like to first give you an update on our enrollment, which is always on our minds at St. Mary's. Next slide, please. The college had a strong entering class for the fall 2020 semester. Applications were the highest in over a decade, reflecting the positive efforts we've made to revise our curriculum, update our brand, and broaden our marketing. Overall, enrollment is higher this fall than last year. Next slide. The college spent the summer months planning and preparing to open our rural residential campus in a way that would maximize the safety of the campus community while enabling us to continue providing an excellent academic program. The slide shows a number of the measures undertaken towards that end. You will see on the slide that things that they discuss at USM and Morgan State are exactly the same things we did here at St. Mary's. We're a month into the semester and believe that our efforts have been effective. We closely monitor COVID-19 cases continuously against a set of triggers we've developed that would signal the need to transition to fully remote operations. Next slide. Other measures we've taken include reducing campus density among students, faculty, and staff, and suspending varsity athletics through the end of the calendar year. Next slide. While the college constantly works to provide a safe and healthy environment for work as well as for teaching and learning during the pandemic, our faculty are continuing to implement our new LEAD curriculum, which integrates professional development skills throughout our liberal arts program, and develop new majors to ensure that when this current crisis ends, St. Mary's College will remain relevant and responsive to the changing needs of society. Next slide. As you can see from this dashboard, so far this semester, we have not experienced a significant spike in COVID-19 cases. Overall, our students have acted in accordance with our ethos, the St. Mary's Way, and have followed our policies. When we experience issues of non-compliance, we act quickly and as transparently as we can, reinforcing to our community the importance of living safely during these difficult times. Next slide. Of course, operating a college campus during a pandemic presents significant fiscal challenges. We're grateful for the federal and state support that we've received. However, the fiscal impact is severe. Last year, the net impact of the pandemic was $3 million, which is about 4% of our overall operating budget. Information for the slide was updated last night, but the new projections reflect additional loss of revenue from room and board. Thus, we anticipate an additional COVID-19 related impact of $4 to $5 million in revenue this semester, which is 7% of our operating budget, that could approach $8 to $10 million for the fiscal year. The COVID-19 financial burden has come in the midst of an anticipated lean budget year attributed to the college's Board of Trustees voting in February to freeze FY21 tuition, room, board, and fees so as to keep St. Mary's College competitive and affordable for Maryland families. The ever-rising pandemic expenses on top of the planned $1.2 million loss in revenue because of the freeze leaves St. Mary's College in a very precarious financial position of not being able to afford to continue to offer the type of educational excellence we're known for at a time when our enrollment of new students and our national ranking are both ascending. We will address the projected budget deficit via temporary salary reductions ranging from 0 to 25%, depending on the individual's base salary. We're planning, we will have furloughs and terminations, budget reductions, hiring freezes, travel restrictions, and all the other things you've heard about from the other institutions as to what will be done to try to balance that budget or to at least plug the gap. So next slide. So again, I want to thank you for your continued support of St. Mary's College of Maryland, and I'm happy to address any questions. Thank you.
All right, thank you, Dr. Jordan. Any members of the committee with questions? Or the Senate subcommittee? Chair Zucker, do you have any members?
I don't see any, Mr. Chairman. I think we can go ahead and we've got one more panel before we conclude for the day.
Thank you, Dr. Jordan.
Thank you.
Thank you very much, Dr. Jordan. With that, we have representatives from the American Federation of State, County, and Municipal Employees, AFSCME. You have 10 minutes, however you want to split up the time. If you wanted to basically do 2 minutes each, but however you want to take that 10 minutes, please do so. But go ahead and start. It's great to
thank you, Senator
Stewart, and your members.
Thank you, Senator. We will try to be brief. Senators, delegates, chairmen, chairwomen, Stuart Katzenberg, Director of Collective Bargaining and Growth with AFSCME Council 3. We appreciate you giving us the opportunity to talk about what's going on our campuses, both financially, but also most importantly for health and safety. Could you please pass the next slide? Thank you. So we represent 90+% of all public higher education workers in the state of Maryland. And our union has sort of seen it all at this point. And frankly, we've been, for the most part, really disappointed by the response of higher education leaders. Slide. At St. Mary's, negotiations have been completely hostile. In meeting with HR, they resisted any calls for mandatory testing and said they would only test unless the governor made them. There's been a complete lack of transparency about how decisions have been made. Our members were not involved in any way of shaping the health and safety plan. At BCCC, which I know isn't at this meeting, but is technically a state entity, they've refused to negotiate throughout the pandemic and have not responded to us contacting them. We have multiple ULPs pending at the Labor Board. A bright spot has been Morgan State, where we've met with President Wilson. We met with him relatively early, and we mutually agreed about the need for testing and supported each other in driving to get mandatory testing. And that has helped prevent a lot of our members getting sick. And when some of them have gotten sick because of the regular tests, it's been able to prevent a greater spread. We're bargaining with them next week. Slide. With the USM, we've been really disappointed. The system has the ability to create health and safety policies to cover every campus, and they have refused to negotiate with us about policies. Instead, every campus sort of does their own thing. We actually approached this system before campus closures in early March because we were concerned about rising COVID-19 around the country. AFSCME members in California were already experiencing it, and we wanted to get ahead of it. We were disappointed in that meeting, and we've remained disappointed throughout the pandemic in their response that instead of creating policy, they create guidance, principles, and concepts to avoid bargaining with AFSCME. AFSCME and its affiliates, we're not involved in any campus plans for health and safety for our members. Our members have continued to report throughout the entire pandemic, keeping the campuses operational and putting themselves in grave jeopardy. We've continued to also have a problem about transparency by campus and system-wide about any of our members getting infected with COVID-19. They refuse to give us any numbers. We believe our members have a right to know about unsafe working conditions. If there's a chemical spill on a campus, we would have the right to know where that chemical spill is, so to prevent further danger for our members. In this case, with this airborne virus, we're not even getting locations of where there's been outbreaks or where our members have been working, where they've been get sick, or students. There's no accounting, and it's been a great disappointment. Next slide. At Bowie State, the administration didn't tell our physical plant staff and our union leadership that they were setting up a quarantine dorm on campus. They repurposed a dorm that had been closed. Next slide. The sign on your left was taped on the door, which was the original sign, and only sign on the building about it being a quarantine dorm filled with sick students. The newer sign on the right was just updated. Our members refused to work it because they were not given proper PPE or trained at Bowie. We advised them it was an unsafe condition and they should tell their supervisor that. At Bowie, they also have refused to bargain any furlough policy with AFSCME and said, this is what it is, in a hostile meeting 24 hours before it was released to the whole campus. Next slide. At Frostburg State, which you'll hear more about of later, the administration had furlough plans that had been emailed around to campus throughout the summer, and they refused to engage AFSCME. Their plans at virus control, we were skeptical of, such as just hanging shower curtains from the ceiling. They do not have quarantine or isolation on campus. Students are sent to the quality and off campus, and we have our concerns. Next slide, please. You know, there's been a lot of national and local coverage about these problems. We continue to try to engage and talk to the USM about engaging us and the campus about health and safety, but they refuse. We continue to find problems on the back end where our members have gotten sick or in grave danger, and the campuses respond at times. We think it's time that we have uniform bargaining that's cost efficient, saves the state money, saves the institutions money, instead of us fighting the same fights at every campus where we end up with different results. An electrician at Frostburg shouldn't get treated differently than an electrician at UMES. A coordinator at College Park should not be treated differently than a coordinator at UMBC. Next slide. We've also gotten support from faculty and students across campuses. This is a copy of a letter from the professors in arts and humanities that had 279 signatories they sent to Daryl Pines with grave concerns about the public health of our membership, because they've seen how in danger they are on a daily basis as they continue to report, both physical plant staff, but also office staff who have to report navigating childcare challenges, as well as other challenges. Again, we've seen a very subjective micro approach to the health and safety within departments and divisions across campuses, but that isn't what we need here. We need a policy that protects everyone, that makes sense, it's efficient and uniform. Next slide.
Mr. Katzenberg, I just wanted to let you know that you have about 5 minutes left. So
yes, and I'm sending and
no problem. However you want to proceed.
So Kiana Tillman will be speaking next from UMES.
Good afternoon. My name is Kiana Tillman. I'm a proud AFSCME member, employee, and alum of UMES. And to be quite frank, in the midst of COVID, the goal is just to keep everyone safe. So I just have a simple question. Why don't we have a consistent plan across all USM schools? Prime example, just a few miles up the road from UMES, Salisbury State has well over 200 cases. However, they're handling it entirely differently from how UMES is handling it, when we only had 23 cases thus far. And if we're all allegedly on the same team, then why aren't we all playing by the same rules? Until AFSCME did a caravan this summer, we were not involved in any planning or preparation for the reopening of school. But since then we have. Even though they're lacking transparency with the reporting to the union, UMES is doing a lot right compared to the other USM schools. We're negotiating health policies and safety policies, and as well as cost contingent agreements. We have public safety at every entry point on campus doing sentinel screening. Our students are holding each other accountable. We're doing testing every 3 weeks. UMES is basically on the right track. However, the pandemic has hit us hard. Over the last 5 years, we've been struggling financially and facing budget cuts and furloughs within the USM school, which is why we really would like for the legislation to be done that was mandated last year with the HBCU budget lawsuit. Our team is being spread extremely thin. We're being tasked to do much more with less people. Our housekeepers are short-staffed and unbenefited, meaning they don't receive retirement, nor do they receive health benefits from the university. We're being asked to, a student affairs professional like myself, we're being asked to deliver food to the quarantine houses. We're working the testing sites, and we're still trying to keep campus as normal as possible, because at the end of the day, our students and our employees is what matter. Once we did discover that we were having isolation and quarantine housing on campus, we wanted to figure out what was the game plan. What concerns did we have was that nobody thought about the simple fact that these people will be cross-contaminating, our workers will be cross-contaminating each other, because they don't just work out in the quarantine stations. They actually go back to their remaining jobs. So, and they also don't receive hazard pay, nor do the student affairs professionals who work the quarantine housing. They also don't receive hazard pay. However, since then, we have negotiated with UMS and the staff working in quarantine facilities. They're going to make them their only assignments, and we are finalizing a hazard and emergency plan for those who want to work it. Essentially, all I'm trying to say is our students are taking precautions, our employees are taking precautions, our university is taking precautions, and now it's time for the USM to follow suit and take precautions as well for us. We all want to play by the same rules. Thank you.
Ms. Tillman, thank you so much for your testimony. Who else wants to go next, please?
Maria?
Oh, my name is Maria Ayala. For 15 years, I've been housekeeping at College Park, Maryland. My coworkers and I are afraid to health and safety because UND has already failed to protect us. In May, I was one of the 108 residential facilities staff, the majority who signed a letter to demand enough PPE. When we return to work, each morning we are getting one of these masks. We go through a mask quickly while we are working. They get very sweaty before lunch. It is disgusting and dangerous to put them back on. We had demanded 3 masks a day. That's how many as housekeepers who clean classroom buildings receive. In June, July, during the record of wave of heat, with 20 straight days of 90+ degrees, UND turned off the AC. Indoors, we were cleaning. It was much harder inside the outdoors. I got sick, as many as my coworkers did. One of them got hospital. It was hard to breathe, and I had a headache, and my stomach was upset. Many of us housekeeping thought our symptoms were COVID-19. As another housekeeping had a severe case just a few weeks before. My doctor thought that it was because the high temperatures, my symptom was because of high temperature. President Daryl Pines only met with us and turned on the AC after we took action on social media and press. Many of us who got sick from the heat had to fight with UND to restore our sick leave for those days we lost. 2 weeks ago, I had to take the hard choice to stay home because my son is taking class online on kindergarten. Right now, the USM has more than 500,000 of hours in their leave reserve fund. Staff like me deserve access to their leave during this pandemic. Our leave policies are not explaining clear in English, alone as in Spanish, putting many of us in risk and causing unnecessary fear. I thought I would not get paid until the union explained the policy to me. UND leadership is putting everybody in danger. They had to listen to frontline us working like me and bargaining in agreement and to ensuring our safe for all on campus. Thank you very much. I'm sorry for my English.
No, thank you. Thank you for that. And thank you for your testimony. And I know that some of you had to take time off work. So we just appreciate you being here. And with that, we can turn to the next panelist. I don't know if Mr. Holden or Blair News, if you want to go, but please.
Blair.
Good afternoon, senators and delegates. I'm Blair Miles. I've been the chemistry lab manager at Frostburg State University for the past 7 years. I work with students daily for class, research, and as their work study supervisor. Our students are the best part of my job, and watching them grow as scientists and people is extremely rewarding. However, this has been a safety nightmare that I never thought I would have to address in my labs. On January 27th, FSU made its first announcement to the campus community related to COVID-19. On March 13th, FSU canceled classes for the day and sent students home for spring break. However, most of my union brothers and sisters remained on campus without PPE for almost 2 weeks. FSU still told students to pack a bit more than normal since we might have an extended break. These plans shifted from extending spring break until April 6th to the complete end of face-to-face instruction in less than a week. Campus was closed 2 days after the scheduled end of break. The last-minute decisions seem to have continued since. Frostburg formed 14 different subcommittees to plan for the reopening of campus. Labor was not involved until the plan had been finalized and they had begun implementation. The plan was released on June 15th to the campus community, announcing an early fall semester start of August 17th. The members who were most impacted weren't included. Temporary and incomplete measures continue to leave us at risk as problems aren't addressed until labor brings them to the attention of the administration. There are still, as of Friday, shower curtains up to protect staff. Students are expected to disinfect public spaces throughout the day, and the only screening outside of the physical plan is self-reporting of subjective symptoms. Our members were scheduled to transport COVID-19 positive students to Quality Inn off campus for quarantine using a university van retrofitted with plastic sheeting and duct tape. The management solution was to have staff from outside the bargaining unit do the job. I don't know the procedure to keep these COVID positive students from leaving the Quality Inn while they are off campus. I am fortunate that I am in a department where we always have had PPE, and the move to purchase necessary materials was made back in April. My supervisors have left me with the freedom to telework as much as my duties allow. Several other colleagues in departments are completely teleworking during this crisis. We're fortunate. The official stance is that it is up to supervisors to determine their department's needs, so others are expected to be on campus with students every day. Even outside of our physical plant, many of our staff can't work from home at all. This is unfair and unsafe. We were just given a furlough plan on Monday after months of circulating it on campus, but management had been refusing to discuss it. It is in its current form. All of our employees face temporary salary reductions. FSU is a fantastic institution. I get to tell prospective students that it's so nice that I'm an alumni twice. But the last 6 months have left me increasingly sad, hurt, and angry. It's a mess that wasn't properly prepared for, and should have been different from the start.
Well, thank you very much. And the last witness for today is Todd Holden. Mr. Holden, thank you for being here. And if you kind of summarize your remarks and just hit the high points, because we do want to hear from you, though.
Well, I appreciate it. Thanks. So my name is Todd Holden. I am a shop steward and interim president of AFSCME Local 1072 at the University of Maryland, College Park. And like my brothers and sisters have said previously, this thing is still rolling on. I think that one thing that is really revealing about this whole crisis is that not only does it really highlight the individual's characters when they're faced with a stressful situation, but it also highlights the institution's characters at the same time. And I think that we can see the ways in which a lot of weaknesses and a lot of inequities within the system are just being exacerbated by this. Even today at College Park, we are still chasing down lots and lots of problems. And management will say, as a point of pride, that they have met with the union, dozens of times since March. But that's often to address these problems and these flaws and these errors and these things that are putting our workers in danger. If the universities or the system itself were actually to negotiate with the unions, as is their right, we would have a lot less meetings. There would be a lot less problems. We would find that when worker voices are actually added into the mix and substantive agreements are reached, we would actually be achieving the excellence that the system claims to have, that the institutions claim to have, and frankly, what Marylanders expect from all of us. This is a situation where we need to be at our most excellent. We need to be at our most extra in order to get through this together so that no one is left behind. However, when I hear today that housekeepers who speak Spanish still do not know how to obtain testing, whether or not they need to obtain testing, and all of the problems that they have in just trying to get that accomplished, I can see that the response is not yet sufficient and that it requires worker voices at the table in order to solve this. I would ask the committees and everyone in attendance to actually examine whether or not we are achieving that excellence that we are claiming to have. And I think that until we have that sort of reckoning, and that labor and management are on the equal footing, as is guaranteed by both the intent of the legislature and the state's laws, we're going to be going at this for much longer. And
thank you.
That's something that we need to avoid.
Well, thank you, Mr. Holden. And I was, it stuck out to me with the sign on one of the buildings that I guess was under quarantine, that it says, please take off your PPE to stop the spread of the bacteria. And I wish it was that easy that we could just throw antibiotics on the bacteria, but it's actually a very deadly virus that's been spreading. But with that, I'll turn it over to Chairman Barnes.
Well, thank you, Stuart, and thank you, AFSCME, and all the AFSCME members for sharing those concerns. I know that we need to hear that. We need to know what's going on. We had allotted some time for any of the institutions to respond to the concerns raised by AFSCME, should they feel the need. We had asked that to be 2 minutes, but we are over time. So if any of the institutions do want to respond to these concerns, we'd ask you to keep it to 1 minute, and now would be the time to raise your hand. And I don't see any. So I think, Mr. Chairman, I think we are good. So thank you to everyone on a great briefing. We appreciate all of you being with us and sharing your time and sharing your concerns, and the universities giving us an update. We appreciate that. Closing remarks, Chair Zucker?
No, we just appreciate everybody's time today, and you can view this later online as well if you weren't able to see the full briefing.
Thank you all.
Everybody.